Bariatrics is the study of medicine in which we perform surgery in order to alleviate weight, have weight loss, and essentially resolve comorbidities, specifically diabetes, high blood pressure, and sleep apnea. We seek patients who have a BMI of greater than 40. BMI stands for Body Mass Index. You can calculate your BMI by going online and typing BMI calculator. If your number is between 35 and 39.9, you must have either high blood pressure, diabetes, or sleep apnea. Not all three, but if you have one of those comorbidities, you're also considered a candidate for surgery. We certainly talk about three categories. First and foremost, diet and exercise. We then talk about the additional use of medications. And lastly, we talk about surgical intervention. The most common operation we perform now is the gastric sleeve, and essentially I refer to that as the 21st century stomach. We narrow the stomach size down to about 1/3 of its original size, which creates a sense of fullness or feeling of satiety much quicker than a normal stomach would. That obviously helps attribute to weight loss. We don't disrupt the absorption of food or rearrange the intestines, but it is very successful, and it's what we call a low maintenance operation. We also can perform the gastric bypass. That's essentially when we bypass with the intestine the majority of the stomach. That helps and creates significant weight loss, but it does create potential malabsorptive issues, so we must follow those patients' vitamin levels very quickly. It's what we would refer to as a higher maintenance operation. When we do these operations, we're expecting a minimum of 50% of excess body weight loss, anywhere up to 75 to 80% of excess body weight loss. What do I see in real-world terms? Roughly at 6 months, I commonly see 60 pounds of weight loss. At 8 months, I usually see between 70 and 80, and it is not uncommon to see over 100 pounds of weight loss within the first year to year and a half. But the real reason for bariatrics is the resolution of comorbidities, the no more insulin for diabetes, the high blood pressure that is resolved, the patient who no longer has to wear their CPAP device because their sleep apnea has resolved. Those are the impacts that bariatrics makes that improves a patient's life, their longevity, and in a sense their ability to enjoy life.